Well, it's good to be back up here, and I just have to say thank you so much for being here, and welcome back to so many of you who've been here with us before. And if this is your first forum with us, welcome to the family. We really are a family, and love having you by our side in this important work. So just to remind everyone, the mission of our organization and the goal of my presentation today is to let you know what we've been up to, what we accomplished, a little bit about what we accomplished last year and where we're headed, and really help you understand how some of these things might fit into the national framework for systemic change to improve screening and detection of maternal mental health disorders. So our mission is here on the screen. It's to close gaps in maternal mental health care by the year 2020. And what year is it now? How many years do we have left, right? We got to get working, and we got to get really serious. We've been doing this work and have been working very hard, but it's time for real policy change, and that's where we are now. I wanted to acknowledge a couple of organizations here on the top of this slide, and acknowledge that we stand on the shoulders of giants. People have been doing this work, just like Dr. Wisner, for over 30 years. And this year, Postpartum Support International, which was founded here in California, turned 30 years old as well. So we wanted to acknowledge the great work of our sister nonprofit, PSI, and we're so glad to be able to divide and conquer this work with both PSI and also Maternal Mental Health Now. You've heard Maternal Mental Health Now about Maternal Mental Health Now earlier. They're based here in Los Angeles, and they're one of the leading nonprofits in this space nationally. The Los Angeles County is a significant sized budget, and lots of women deliver here in Los Angeles County, and they're learning a lot about integration in healthcare systems. They are also focused on health disparities in a very powerful way. And so we wanted to acknowledge both of those organizations as our partners. We also have a couple of other funders that have been doing a lot to contribute to the field, including the California Healthcare Foundation. We'd like to give them a shout out. I think that they're watching today. And then the Walton Family Foundation. They've recently changed their name to the Zoma Foundation. The Ben and Luciana fund of the Walton Family Foundation changed their name to the Zoma Foundation, and they've been contributing to the field in a very powerful way as well. So wanted to, a lot of people like infographics, right? To me, they can get overwhelming, but this tends to be a little bit of an infographic, lots to see on the slide, but a quick year in review. You heard a little bit about the National Coalition for Maternal Mental Health, which brought together multiple organizations doing work in this space for collective voice around advocacy, federal advocacy, also social media awareness campaigns. And it turns out that this year, because of some significant player changes in the field, that we have actually decided not to continue right now the National Coalition for Maternal Mental Health. It's really those three players, 2020 Mom, Postpartum Support International, and Maternal Mental Health Now, that are really leading much of the work that's happening. And a lot of other smaller nonprofits who weren't originally at the table with the National Coalition. One of our key programs in 2017 included lobby days in DC, and I'm gonna ask, I know there's a few people in the room that were able to go to Washington, DC with us, and if you could raise your hands. So we've got people up here, and I think Alam, there might be another person or two that joined us in DC. And so we're going to be going back. You'll hear about that in just a moment. But thank you so much, all of you, for raising your voice for bringing postpartum depression out of the Shadows Act. And last year, we lobbied for funding of that act, and I'll give you an update on that in just a moment. Also here in California, we had the privilege of hosting essentially a blue ribbon commission, if you've heard that term, bringing together a group of experts in multiple fields to study a particular issue. And we're able to host with some funding from the California Endowment and the California Healthcare Foundation, host what we called the Task Force on the Status of Maternal Mental Health Care. And in April, that task force unveiled a white paper, which you can see here on the screen. And you also have a copy of the executive summary in your packets. I'm going to show you, this is the full report, but there's an executive summary in your packets. And this really serves as a roadmap for change in California. We heard earlier that 1 in 8 births in the United States happen here in California. So what we end up doing here will impact a lot of lives. We also had the opportunity to launch our ambassador program, which I alluded to earlier. There are a few ambassadors in the room, and this was our attempt to give people who wanted to join our work some meaningful opportunities to go deep in maternal mental health in their own communities. So take a look at our ambassador program to learn a little bit more. You can see one example on this slide of an ambassador activity is to hold a diaper drive. Research shows, and I think we actually have colleagues from Yale watching today, and a researcher from Yale led a study around a diaper need and the correlation between postpartum depression and a diaper need. So this is one way we can raise awareness and collect diapers in our community and put a beautiful sign up that explains why we're collecting diapers and do something good in the community. We also had an opportunity to launch a webinar series, which I love. I love doing this, and I love hosting webinars. And let me ask if anyone has been on one of our webinars. Can you raise your hand if you've attended a webinar? So not enough, because I think you all, if you've been on one of the webinars, did you love them? Like, I love them. It's this information in an hour to an hour and a half, different topics, different experts, and it's a great way to go deep in just a little bit of time. And they're recorded, so even if you can't make a live webinar, you can register and get a link later. All of those recording links are on our website now, so feel free to go back and take a look. But I'm thrilled to host those webinar series. We also were invited, and there's another colleague, I think, in the room, Anna Sutton, a prior board member, that joined the ACOG expert work group on maternal mental health. Again, ACOG is the American College of Obstetrics and Gynecology, and we're doing some really important work to help OBGYNs implement change. Finally, I'm going to mention, with the help of the Walton Family Foundation, the Ben and Luciana Fund, now the Zoma Foundation, we launched what we call the Innovation Awards. Who submitted an Innovation Award program? So we have, thank you, Anna. We have 3 categories for awards: programs in care, so model programs in care, community-based programs, and advocacy-based programs. And we're about to launch the opening a new application period for 2018 awards. So if you know of programs that are doing great work and have some outcomes already, not new programs, but proven outcomes, the goal of the program is to help other communities scale change. So if a hospital submitted a program, for example, we asked for some detailed, like, how did the budget work? Anything that's not proprietary, policies and procedures. And the idea, again, is to help others throughout the United States scale and implement similar programs that are working. So I'm going to quickly go into what's new for this year. And the first box up here on the slide is the rally that we held in Sacramento last week on Monday, wasn't it? We've been busy. And this was to leverage the energy around Jessica Porton's story. Jessica Porton is the mom, again, whose story went viral on Facebook. And she actually lives in Sacramento. And we had planned on going up anyway to do a photo opportunity and meet with some legislators and have a great journalist cover that story, and have 4 of our fathers who've lost wives or babies or a combination of both join us. And when Jessica's story broke, we knew that the stars were aligned, that this is the time to do this great work here in California and beyond. I'll talk in just a moment about the legislative package that we rallied for, and just again want to acknowledge the journalist that covered that story, and also Jessica, who I think is still watching. You'll see a little blue ribbon or a greenish tealish ribbon on the top of this slide that says Hope and Grace. They're another project funder that has funded a project around peer support. So if you are like me, again, right, we know there's a shortage of treatment options, and we know that many women don't feel comfortable for a number of reasons. We've talked about them today, cultural reasons, talking to healthcare providers about what they're experiencing, and that peers can be both protective in talking about struggles and also help link patients to care and moms to care. Hope and Grace has given us a grant to study the infrastructure that is currently in place called Certified Peer Specialists. Let's see, it's 47 states in the United States have a Certified Peer Specialist program where the state issues a certification for peers to be trained, and most of those states also allow those peers to get reimbursed through their Medicaid programs. So we're really interested in learning if that chassis is a good one for our moms to be certified, and I mean our moms collectively to be certified and be placed in institutions like hospitals or clinics that are already billing Medicaid and have the ability to sustain those programs because they're getting funded. Those results should be available early next year, and we're studying that work in two areas. One, hotspot, we like to call them, and Sage, who's here, has created what I like to call a hotspot for postpartum depression heat maps that identify using census data what cities or geographic locations are at high risk for postpartum depression, a number of women. And the results of that work will be published soon, but we know that Houston and Phoenix, Arizona, also spots in California and other parts of the United States, but those two cities rank 1 and 2 in terms of high risk for postpartum depression. So we are piloting that peer support program in those two cities. Next, I'm excited to announce, if you have seen some blue dots around, to explain that the Blue Dot Project is moved into a project that we're hosting. If anyone has seen some of the coverage around the blue dot becoming the national or international symbol for maternal mental health, you know that this is the symbol we're trying to get out to all of our communities very quickly as a symbol of support for women who may be suffering now, solidarity, and community. We have magnets that can be purchased. You can see Get Your Dot on the bluedotproject.org website that we may give you a sneak peek at, or if you go directly today, you'll see that website is not quite finished, but dots can be purchased now, and we'll be relaunching that website and announcing its launch in a couple of weeks. And Robin, thank you for chairing the Blue Dot Committee. March for Moms. So we talked a little bit about lobby days this last year and going to DC, and we're really excited to announce that we're partnering with another nonprofit organization called March for Moms, and their interest is not just in maternal mental health, but in maternal mortality and in preeclampsia, other issues that impact maternal health. And we decided to join forces, and they're having a rally on the Capitol Mall on May 6th. We're hosting a day of training like we usually do on May 7th, and then together on May 8th, we'll all be advocating and lobbying with our congressional members. So we would invite all of you to join us. Again, May 6th through 8th, that information is available on our website, and registration just opened last week. I also just will quickly say that our Innovation Awards program will accept new applications in about a week or two. We're looking to be very specific this go-around on model programs, including recognizing hospital-based programs in an effort to lift up what's going really well in a hospital setting. So more to come on the Innovation Awards. The last thing I'll mention is that last year we launched our first social fundraising campaign, which involved walks, and we did those walks at the March of Dimes walks in an effort to bring awareness materials to moms in those communities who are at high risk or were at high risk and may have suffered themselves either because they had an untreated depression or anxiety during pregnancy, which could have led to preterm birth, or a NICU baby and needed support. So this year we're changing things up just a little bit, and we're launching what we're calling the Motherhood Color Walk. And this will involve, if folks have seen the color dust that the Holi Festival is known for, we will ask people to form teams and together at your kickoff, dust each other with color dust and then distribute materials for your walk in a community location. The weekends that we're targeting include a weekend over Earth Day, so there'll be community festivals. People can also bring their walks to local malls, and we have race bibs that will show that you're walking for 2020 Mom. And we're looking for national sponsors and local sponsors for teams as well. We're really excited about this, again, in an effort to raise awareness and funds for maternal mental health. We also know that there are nonprofits that may be interested in partnering with us, and 80% of the funds raised by those teams will go back to their nonprofit. All right, so I mentioned a while ago that we wanted to talk a little bit about legislative advocacy, what's happening in California, and I also first wanted to start by saying that, again, we sort of stand on the shoulders of giants, and a lot of work has been done in other states previously, and we'll start just briefly by announcing which states have been tackling maternal mental health in a pretty aggressive way. First was the state of New Jersey, when the governor's wife at the time came out with her story, and New Jersey launched a warm line and a campaign called Speak Up When You're Down, which so many of us still know about that campaign, and other states adopted that campaign. Illinois, as we heard, was also a state that led the way in mandating screening, among other things, and they're really doing some great clinical work in Illinois as well, some great champions there. The next state is Massachusetts, and Massachusetts is the first state that has created a standing commission for legislation around maternal mental health disorders. They're doing great work. They have a public health program where the state is reporting on all of the work that's happening. And then we heard earlier that the California Task Force on Maternal Mental Health, the Blue Ribbon Commission, met and issued its report. Also, in Maryland, the same thing happened last year. So the state of Maryland ran a commission or a task force and issued a report, and that was hosted by the Mental Health Association of Maryland. They have implemented legislation, two pieces of legislation in Maryland. So let me tell you just a little bit more about the task force report and strategic plan for California. These are members up here of the task force. I think we had a few folks that were missing that day, but you can see the signs say thriving moms equal a thriving California. And again, the program was funded by the California Endowment and California Healthcare Foundation. So the end game, what was helpful was that the commission or task force said, okay, what is our goal? How will we know if we're succeeding in measuring outcomes for success? And they said, we want to see, even though 2020 Mom's goal is to do some great work by the year 2020, we want to see 100% of women being screened for maternal mental health disorders by the year 2025, and 80% by the year 2021. And again, it emphasizes, I mentioned this earlier, that OBGYNs really are the home base for screening and detection. They have to screen and detect. We all believe that's true, including the American College of Obstetrics and Gynecology, but there's also no wrong door. So pediatricians, lactation consultants, others need to be prepared. So overview of the recommendations briefly, there are 5, and again, if you wanted to pull out the executive summary, you're welcome to do that. The first recommendation and acknowledgement was that all women need more maternal mental health education and support. And so we know that that's necessary to reduce stigma and educate women. And I first want to say, Robin, the best way that we can reduce stigma is to have people like Robin tell her story. Wasn't that beautiful, with humor? So we've got to get creative about how we get more stories out. So thank you, Robin. The second acknowledgement and recommendation deals with providers and the fact that providers need more support as well. They need referral pathways and they need additional capacity to manage and treat these cases when they're discovered. We note that we need to address knowledge gaps in providers, also address treatment shortages, and again, capacity. So once I detect we have a positive screen, and I create a treatment plan, how am I going to manage that woman and make sure that she's getting the care she needs? 3 is the need to integrate mental health and medical systems. And I know some of you, we've talked about this before, right? I think someone at lunch, we were standing outside and talking about, how come lactation consultants can be embedded into pediatric settings, for example, or even in an OB office, but why is it so hard for mental health professionals to be embedded? And it really comes down to the fact that we're still carving out our mental health coverage, both in Medicaid settings and in private settings, and it's really about payment and payment reform. So right now, providers have a contract with an insurance company, for example, for medical services. A hospital, if they wanted to provide behavioral health services, would have to go get a separate contract, right? We don't do that for diabetes care. We don't carve out the heart, we carve out the mind. And I think there's growing recognition that payment integration has to happen before we can truly have system integration for patients. Number 4 is the need for measurement of screening rates. We talked a little bit about this in the infant mental health panel, and that is we don't know how often providers are screening. We really don't know. There might be research that will document a single point in time, but we don't know if those rates are getting better now that ACOG has issued a recommendation to screen, or staying stagnant. And until we know that and can publish those results, we can't put enough resources around the issue. And that is actually being tackled, I'll say, by the two of our funders. The California Healthcare Foundation and the Zoma Foundation have funded work to create a new HEDIS measure, for those of you who are into measurement and know what that is. So things will be forthcoming, though they take quite a bit of time to implement. So detailed recommendations for all stakeholders. So again, acknowledging that everyone can play a role, including the lactation association, trade association, pediatricians, employers, business groups on health, for example. All right, so let me tell you a little bit about the California bill package. But before I do, how's everyone doing? Good? Getting a little sleepy, I think, right? I feel like I could use a little coffee myself, but thank you for the thumbs up. You want to get me some? Oh, I love that. My team is fantastic. All right, so you might have seen when we were doing the coverage of Jessica Porton's story and using hashtags that moms started to say mom for action and mom for 4 bills in California for maternal mental health, moms for, or states for. And so we have implemented based on the recommendations from this California white paper, approached legislators, and many of them really sought all of us out to help create bill packages to address these gaps in care. So number 1, and it's something that we think a lot of states might have an interest in doing, it's asking that the California Department of Public Health draw down federal funds that would be available from the Bringing Postpartum Depression Out of the Shadows Act that we all lobbied for in DC last year and the year before. That one should be a slam dunk, and we don't expect any pushback. The Department of Public Health is aware and agrees that it makes sense to apply for those funds. Number 2, this is the meaty one. We have a champion who is from San Diego, a father, legislator that feels strongly that there should be a mandate on OBGYNs to screen. And we said, we can support that, but first we need to provide support. And so what does that support look like? It came again from the California white paper and asks for insurers and health plans. Many of you may have accessed case management programs from your health insurer for low back pain or asthma. If you have a child with asthma, there's programs that manage chronic disease. and we're suggesting that a program be developed for maternal mental health. And we know that a lot of insurers are already developing such programs. Cigna has an interest, and this is really just going to help make it a priority for all of those health plans and insurers in the state. Number 3 is, again, looking at the chassis of health insurers and health plans to help scale change, asking that health plans and health insurers develop provider-to-provider, 5-day-a-week, 8-hour-day telepsychiatry consults for OBGYNs and other providers who are screening mothers. It will serve, again, as a lifeline to be able to consult and prescribe drugs if necessary with the expertise of psychiatrists, including reproductive psychiatrists. The last one is hospitals. Asking that hospitals develop programs for patient and provider education and look at other interventions through the development of quality management programs. So those of you that work in hospitals already know that there are quality management frameworks in place, and that this could easily be attached to a quality management framework and provide hospitals with some leeway in developing these programs. All right, last slide, and I'm anxious to hear your feedback around that bill package. We're going to have our policy breakout sessions here in just a moment, and you'll get to talk about those bills in depth in your groups. So one thing that we're launching this year, pending a grant that we hope will come through and launching this summer, are what we're calling collaborative learning networks. So we often will get phone calls from hospitals or public health departments or advocates in states saying, what do I do? And we decided that the best way we can learn is to pull people together in these collaborative learning networks so we can all learn from each other. These learning networks will be available through a membership subscription, and people can join them for any reason and create interest areas like I want a interest area on support groups. And then people will convene around that topic area, share information, etc. The Learning Network will also have the capability, not just with the listserv for that Learning Network topic area, folders to upload information, for example, hospitals that want to share something they've done, but we'll also have webinars on those topics and technical assistance calls that all of those hospitals or public health departments or state advocacy organizations will be able to join. So that, again, will launch this summer. We may ask you for letters of recommendation, so our grant comes through, so be on the lookout for some help. And then I also do want to share that state advocacy efforts are happening in several other states, including Arizona, Illinois. We heard a little bit about Illinois' work, and Florida. Texas is also a priority state and had legislation last year, but their legislature is not in session this year. So to wrap up, we have a little bit of a call to action for you. So not only do we want you to come and learn and be together today, but think about ways you can go home and make a difference. And the first thing we want to ask you to do is go to our website, 2020mom.org, and click on Join the Movement, and there's a drop-down that says, It Matters to Me. And we're hoping all of you in this room will go on and say that this topic matters to you. We're hoping that we'll have enough endorsements to prioritize certain markets or areas or zip codes, for example, and help not only pass the California legislation, but really help us move the needle in other states as well. Also, get your blue dot, and I actually have a blue dot, and that's what we're going to give away to the person who's tweeted the most, besides Cindy on our team, or posted the most on social media. We'll get that out in a moment. It's a magnet for your car. And you can buy one now on the bluedotproject.org website. We'll also send some information out through our e-newsletter about that. We also want to encourage everyone to participate in the social media campaign. I hinted at it on the infant mental health panel. That's the first week of May as well. It's also when we're in DC, and it's an easy way for you to just pledge to share all the messages that are shared that week, one key message a day. And again, the theme is real motherhood and keeping motherhood real. And no shame. Thank you. Again, federal and state advocacy, we want everyone to get involved. If you're here in California, if you live here, we're going to need your voice. And I think I'm going to have Ed, raise your hand, Ed, again. Everyone knows Ed. He has become an expert convener and grassroots organizer and is interested in meeting with legislators all throughout Southern California on Fridays when they're here in the district and not in Sacramento. And we need more people that are able to do that work. It's going to take a lot of voices to get the legislation passed. And then finally, I'll just say that, again, if you want to go deeper, we'd love for you to join our ambassador program. There's a lot of great ways that you can get involved and go a little bit deeper in your communities. With that, I want to say thank you. I have business cards outside on the table out here. If you want to connect more offline, feel free to outreach me, and we've got some great team members. Our team, raise your hand just so you can get attention here so folks know how to find you if you have questions.